in the scapula, which is nice, just 2 projections apiece. As far as patient prep is concerned, everything off from the waist up, including any necklaces or chains, just like for this week. So that'll be the same. Scapulas are generally done upright. A shoulder can be done upright or recumbent. And either one of it could be done recumbent, but it's always easier on your patient if you do it upright because of how much pain is involved in lying on that injured shoulder. So keep that in mind. So we are going to show these erect. I'm at 40 inches. Going to start with the shoulder. I have a 10 by 12 crosswise. Remember that when you place the 10 by 12 in here, we're really now going to be at the 24 holes. This is centered up.
Is it significant where we put that? I know you said that y'all aren't going to be as picky where we put that. Since
we're not.
Okay, it doesn't matter.
Not really. Does that make you better?
I was just wondering.
Look at it. I didn't put it so that it didn't show most of the time, but I just didn't pay attention because it doesn't matter.
Okay, doesn't matter.
Okay. All right. So I've got that in. I'm going to take the full 12 inches across. How much I'm going to use top to bottom is going to vary with my patient to make sure I include all the shoulder joint. You're probably going to be somewhere between 7 and 8, but it probably won't take the full 10. Let my patient step up here and put her back up against the board. Now we want to center to the coracoid process. Now the coracoid process is the most anterior process. It is, if you come to the head of the humerus and go just medial, you should feel the coracoid. Even if you can't feel it on somebody, because on some people it's very deep, and if their shoulders hurt, they're not going to let you just poke really hard in there. Just realize that if you find the head of the humerus, you should come in just medially, and that's going to put you about in the ballpark if you can't feel it. Okay? I'm going to ask you to step away from me. Okay, just lean forward a little bit, line this up. Now, the position of the arm is really the only thing that changes here, okay? So we're going to do one on external rotation and one with internal rotation. Check your protocol at your facilities and see. I was always taught to include all the scapula, and if you have to include all the scapula, then you'll have to change your centering point just a little bit, because most of the time if you center at the coracoid, you don't get all the scapula. So,
you mean clavicle? Okay.
I meant clavicle that whole time. Include all the clavicle. Okay. Just like thinking about the scapula I'm going to do next. So including all the clavicle. So if you center at the coracoid, you may not get all of it. Just like right now, even with her with that full 12, I'm really close here. And so I might want to bring her back because I have lots of light here. But the actual centering point should be at the coracoid. So center there first, but if it's your protocol to include all the clavicle, then slide your patient over a little bit.
But for this purposes, we won't need to include the clavicle.
No, you'll get most of it, but yeah, it's okay. Just center at the coracoid because we really want to know you know how to locate the coracoid. All right. Then I'm going to ask my patient just to turn palm up, her arm palm out. Up. This will be external rotation. Okay. With external rotation, what should be in profile? The lateral aspect.
The greater tubercle.
The greater tubercle will be in profile on the lateral aspect. Okay. Now, obviously, here we have a lot of chest, so she's going to need to hold her breath. We are going to suspend respiration for all 4 projections again next week. Make it easy to remember. The phase isn't really going to matter, so just having to hold her breath is fine. Okay. So that's external rotation. Then all we do is swap out our cassette, which we're not going to actually do. Then I'm going to ask my patient to take her hand and place it across her stomach. Now we have internal rotation. Just make sure your patient hasn't moved at all and have them hold their breath. Internal, external rotation, AP shoulder. Ta-da! You gotta like that, don't you? So, okay. Moving from the shoulder to the scapula. For the scapula, I'm still going to use the 10 by 12, but I'm going to use it lengthwise. So now I'm in the 30 holes. And I'm going to go ahead and collimate to include the full 12 inches from top to bottom, and then come in to about 8. Okay, now once you get your patient centered, you may be able to collimate down from that 12, but just leave the 12 initially and look and see how comfortable you are. Because if they're very muscular, have a lot of soft tissue, then you can hedge your bets a little bit. Even though the scapula itself is going to be fairly small, it would fit in a 10 by 12, I mean an 8 by 10, an 8 by 10 collimation, but we'll just kind of play it by ear and see how it goes, okay? I'll have my patient place her back up against the board again. Now this time we again want to find the coracoid process, but we're going to center about 2 inches below the coracoid. So I'm going to find her coracoid, ask her to step away from me. Okay, and I'm going to come about 2 inches below. Then I want to check to be sure I have all the scapula. So I can kind of palpate a little bit. I can find where the medial border is. I can feel good about where that is. I can feel the lateral border. I can find the inferior angle. And as long as that's all included in my light field, then I know my centering is pretty good. Okay. And then I'm going to go ahead and place my marker inside the light field here. Her arm is probably going to be in the marker, but that's okay because the scapula is not. So once I have it pretty much centered up, then I'm going to go ahead and ask her to bring her arm up so the back of her hand is on her forehead in kind of a salute. Okay. Now I can see, like here's the inferior angle. I have a lot of room here and some room here. At this point, I could come back and collimate a little bit if I wanted to, and I'd still be okay. I could move my marker to down here, realize that the clothing always pulls out, so you've got a lot of room there. In your book, he does this with a breathing technique. I think we're good just to hold your breath. I've virtually never shot one of these with a breathing technique. The theory behind that would be to blur out the ribs, but that doesn't really help a whole lot. By doing this positioning, it pulls some of the scapula out away from the ribs, and that's really about all you get to evaluating the superior aspect.
So when they move, when she moves her hand up like that, you don't have to move her a lot more, just like the other position with the shoulder.
No, because you're already centered, and then you can see if you have room to collimate still a little bit.
Okay.
Because you should already be where you want to be. It's going to raise it up a little bit, but not a
Will you press
ton.
a lot more? And you said the marker would be in her shoulder, or in her arm.
It'll be in the arm, and if that really bothers you and you're worried about it, then come down here and you can put it down here. Because look, I got tons of room down here.
Okay.
So. And it might be in the ribs, but her inferior angle is about here. So, we're in good shape. Alright, if I go with that, so that's the AP. She can relax. Now, when you get ready to do the lateral, what you have to keep in mind is that I've been doing her left arm. I have to turn her around, and so now her left arm is on the other side of her body. So be sure you don't all of a sudden laterally position the right arm. Okay, make sure you're still doing the same arm you started with. Okay, I'm going to shift her apron around because it needs to cover up in the back, have her face towards the board. Thank you. Now in this positioning, my goal here is to get the scapula perpendicular to the image receptor. So I'm going to have her bring her arm behind her back. That pulls that scapula out where I can see it well. Then I'm going to rotate her and put her shoulder up against the board. And I'm going to turn her until I get the scapula perpendicular to the board. And I'm going to let y'all come up one at a time and kind of see this and feel it so you can tell what I've done. I'll slide you away from me just a little bit. The central ray should enter the medial border of the scapula. Okay? And I can tell here, I can check this, look. Here's inferior angle. Here's the top. I know I've got it all included. I'm in good shape. I have this big area of light field here where I can place my left marker. Okay? And then I can have her just hold her breath again. Okay. How much you rotate varies from person to person. Can be anywhere from like 40 to 60 degrees, just depends. Whatever it takes to get the scapula perpendicular. So if you want to come up one at a time, I'll let y'all kind of see this and just put your stuff down. You can come over kind of where I am and see how this feels and stuff. See how I'm coming in the medial border and that this is perpendicular.
Okay. Now put my hand on your back.
Okay. Saw the picture with the photo binder.
We're matching that thing too, didn't you notice?
Yes, I noticed that your clothes matched. Your shirts were the same color. That was not lost on you.
Okay.
And then this is perpendicular with that.
Did you say, what did you say you sent her for this one? Just for the mid?
It's the, yeah, it should be the middle of the, I end up being a little bit, they'll say the mid-medial border.
Okay.
I end up being a little bit lower a lot of times, but that's, as long as you got it all included somewhere around the middle. But it allows you to, you have a little bit more up here at the top, so I end up a little bit lower to this just to keep this centered in the middle of my collimation.
Okay.
Because of the muscle and all you have up here. And like I said, she would just hold her breath. And that's it. You can relax, man. So those are the 4 projections we'll do. Now we will shoot an image and we will have anatomy. We'll shoot Pat next week. And we're going to try to shoot Pat in the digital room. So that'll be the plan. Y'all are in the digital room this week.